Hello, everyone. My name is Janet, and I'm a health promoter at Peterborough Public Health. And I'm here to review the Peterborough Public Health Directive for mandatory face coverings, which applies to commercial establishments, public transit services, and commercial transportation services that takes effect on or before August 1st, 2020. For the presentation, this has been prepared with information current as of July 30th. And it is important to note that owners and operators are responsible to be aware of changes to operations required as COVID-19 response. And this presentation is educational only, is not intended to provide legal guidance. The public health measures detailed in this webinar are applicable for commercial establishments, public transit services, and commercial transportation services, whether in the city or county of Peterborough. The purpose of this session will be to review the directive, learn more about the benefits and challenges of face coverings, learn about the recommended components to add to your policy as per the directive, and then review some workplace guidance and signage options. To add a little context to the situation, we are still currently in a worldwide pandemic that was declared on March 12th. The government of Ontario declared it a provincial emergency in response to this pandemic on March 17th. There are many Ontario emergency orders in effect, and currently we are in phase 2, stage 3 of the provincial reopening. And as of July 30th, the present emergency orders require social circles to remain at a maximum of 10, and social gatherings to be a maximum of 50 indoors and 100 outdoors. As you can see here, this is the province's reopening framework, and we are presently in phase 2, restart, stage 3. Now let's review some information about mandatory face coverings. The evidence for face coverings is presently being reviewed, and we have looked at some of the information, and it does suggest that COVID-19 can spread by people who are asymptomatic or pre-symptomatic. And we know that face coverings do not protect the user from acquiring COVID-19, that they are considered a source control. And source control means that they reduce the amount of respiratory droplets in the environment and on surfaces from the person that wears the face covering. We've looked at modeling studies as well that have shown that higher compliance of wearing face coverings is required to achieve a positive impact. For example, if 50% compliance on the use of face coverings in public settings was shown to not be sufficient to spread COVID, not be sufficient to prevent the spread of COVID-19. However, 80% public compliance can reduce the spread of COVID-19. So we do know that based on some of the modeling studies and based on some of the information that we know about asymptomatic and pre-symptomatic individuals, that wearing face coverings may slow or prevent COVID-19. It also provides a visual cue that public health measures are in place, including the need to still maintain 2 meters of physical distance from others. As mentioned, the face covering does provide source control, which reduces the amount of respiratory droplets deposited into the environment by the person wearing the face covering. But this means that the face covering does not protect the wearer. It is for the benefit of others around them. The face covering can prevent the wearer from touching the nose and mouth if it is used correctly. The challenge is if it's not used correctly, it can cause the person to touch their nose and mouth more. The directive that was issued by the Medical Officer of Health was issued under the Reopening Ontario Act. And specifically, this act contains the Regulation 364-20, Rules for Area in Stage 3. And in this regulation under general compliance, it states the person responsible for a business or organization that is open shall operate the business or organization in compliance with the advice, recommendations, and instructions of public health officials. It is under the advice, recommendations, and instructions component of this regulation that Peterborough Public Health has issued the directive. The directive is applicable to commercial establishments, public transit services, and commercial transportation services. We have listed a variety of commercial establishments in the directive so that people can see what may be applicable, but that list is not exhaustive. We have not included non-commercial establishments at this time. However, these establishments, it is strongly recommended that they develop their own face covering policy to dictate where face covering should be used, and especially for any space where physical distancing of 2 meters may be a challenge. In the directive, the medical officers of health's instructions were for you to adopt a policy that requires persons who enter or remain in the indoor public space of the establishment, public transit vehicle, or commercial transportation vehicle to wear a face covering that covers the nose, mouth, and chin. We have also asked that the policy is enforced in good faith with a best effort approach, which we will highlight on the next few slides. We have also asked that you do not ask patrons for proof of exemption, and the exemptions will be reviewed on the next few slides. We've asked that there's appropriate visible signage posted at the establishment indicating that face coverings are required. We have also asked that you provide alcohol-based sanitizer of at least 60% or more at all entrances and exits of the establishment for the use of all persons entering or exiting. We have asked that all employees and volunteers of your establishment or transit or transportation service are trained and aware of the policy and the expectations of your operation. And we have asked that you provide a copy of the policy to anyone that may be authorized to enforce the directive. There are certain people that are exempt from wearing a face covering, and this should be reflected in your policy. And this includes children under the ages of 2, children under the ages of 5 who cannot be persuaded or are unable to use the face covering, people who cannot put on or remove the face covering without assistance, or people who would have difficulty breathing while wearing the face covering or other medical exemptions, and people who cannot wear the face covering for religious reasons. The directive is enforced under the legislation and enforcement requirements of the Act. Particularly, this comes from the Emergency Management and Civil Protection Act, where individuals may be liable for a fine. But for the purpose of this directive, we have encouraged that policies use a best effort approach, and the policy should dictate what your best effort approach will be. So for best effort, we mean that you should detail when and how reminders will be provided to people in your establishment, and also indicate in your policy where face coverings are available for free or for sale to ensure that customers are not being turned away. There will be a significant period of education and outreach, and if there is minimal to no compliance with the directive, then additional enforcement measures may be taken by a public health inspector or another officer eligible to enforce the directive. So as an owner or operator, what are your next steps to comply with the directive? The first will be to look over the directive and to create your face covering policy. We have included a sample on our website. The second step will be to determine your best effort approach and what the reminders and education practices will be used for your establishment and staff. Step 3 will be to train staff on the policy, the best effort approach, how they should be using their face covering safely, and their role with best effort reminders and education throughout the entire operation. Step 4 will be to ensure that there's sanitizer at the entrance and exit locations. Step 5 will be to post signage at entrances indicating that face coverings are required. And step 6 will be to post the policy or have it available to anyone that requests to see it. Now, in addition to face coverings, there are additional policies and protocols that you need to have in place during COVID-19. This includes a review of physical distancing and how physical distancing will look like in your establishment. You will need to identify your screening practices and what signage you are needed. You will need to identify actions that you will take if an employee or volunteer screens positive. You will need to have increased cleaning and sanitation procedures, particularly for frequently touched surfaces. You will also need to encourage and support enhanced hygiene procedures. And if you are an establishment that serves food or drink, to consider your food safety measures. It's important to record customer contact information, particularly for food premises, for contact tracing. Peterborough Public Health has created a workplace toolkit to help you with your reopening safely. Our workplace toolkit is available on our Reopening Safely website at the peterboroughpublichealth.ca webpage. The toolkit walks you through every step of your reopening and includes sections on all the topics that I have just discussed. There's also various signage options that you can use for your establishment. There's signage regarding screening, what to do when washing hands, how to use hand sanitizer, physical distancing, and we of course have signage for requiring mandatory face coverings in your establishment. This concludes our review of the mandatory directive for face coverings. However, we recognize that you may have many questions as you move through this process to set up your policy. We have set up a form on our website where you may ask questions at any time. It is listed under the owner operator section of the mandatory face mask, face covering section of our website, or you can call Peterborough Public Health at 705-743-1000. We have included a variety of resources in this presentation, which I will take a moment for you to review. And we have used a variety of references to prepare the presentation. Thank you very much. And please do not hesitate to get in touch with Peterborough Public Health if you have any questions.